have a doctor here. You're from where?
Central America.
Okay, talk to us as you had reviewed the video about the posture. What is your opinion about the posture and the opinion the other doctor had?
I agree with her. Posture is really important, especially for low back pain or upper back pain and for neck pain. So you should always be aware of it.
What about when she said about spondylitis? What does spondylitis mean? What does she mean by spondylitis?
It's a chronic condition. It generates pain mostly in your neck or lower back. So yeah.
So when she said about blood flow, what was your thoughts when she mentioned that posture affects blood flow?
Oh well, yeah, that's definitely true. So, and actually, she's very accurate on saying that your weight should be evenly distributed when you're lying on your bed mattress. So that's important. And posture is important for many reasons, but yeah, I agree with what you said.
Now, do you advise some of your patients to be very cautious of their posture, or is it not something as a high priority?
Oh, it's a priority, especially for people with chronic pain or that are in PT, physical therapy, for some reason. Posture is really important. They should really be aware of it. Yeah.
Now, when she mentioned stooping, what was your thoughts there? Because that did kind of cause some concern.
Yeah, she's accurate. Most people do it without thinking about it. You're not very much aware of how you're standing or how you're not look. Your shoulders should be going forward. So
now, what about these women that are watching? At what level of priority would you advise them to make sure that their mattress that they're sleeping on is proper, up to date? What are your thoughts there?
That would be my top priority, not only for posture purposes, but because good sleep is good for your brain health. It prevents degenerative diseases. So, yeah.
Now, what do you look for symptomatic for somebody that's suffering from bad posture? When you evaluate a patient, how would you determine that they are suffering from bad posture?
Well, the obvious would be how you see them standing. So if your shoulders should be aligned with your back and not like forward or any other going outward or downward. So that's the first thing. And the second thing, I would say pain. They manifest chronic pain.
Okay, now with the spondylitis, what treatment would you give your patients generally to treat spondylitis?
It's mostly pain management and maybe physical therapy. And that's what it is, because it's a chronic condition. It's not going to be corrected like by taking, something.
Mm-hmm. Now, lastly, the doctor that you watched, she mentioned that something that caught our attention about the table and the chair needs to be aligned. Can you talk about that?
You should never work in a position where your table is too low, because then you have to go up front, and then your back pain starts. The back pain muscles suffer tension, and that tension on the long run is gonna give you lower back pain, and that's gonna be chronic. So it should be properly aligned, and your shoulders and everything should be, at the same level.
Okay, now, some of these women are married with a husband.
Yeah.
Would you give any advice, kind of like when you have husbands and couples helping each other during pregnancy, what advice would you give some of these married women that do have a husband, where the husband can kind of help them along to make sure that they, if they are suffering from bad posture, what can they do to help their wife?
I think just mainly make them aware of the fact that they may be having a bad posture, because maybe they do it and they're not conscious about it. And also, when you're pregnant, you cannot take many painkillers, so there's nothing much.
Is that okay? So you can't do. Okay. Doctor, last advice on the food and the diet. What would you advise if you were talking to thousands of women right now in the state that we are, in processed foods? healthy diets, what would be your number one avocation to tell these women so that they can eat better and stay healthy and live longer lives?
In the best way possible, just eat enough fruit, vegetables that are organic. It's better because they don't have as much non-GMO fruits and vegetables. They're not processed, and avoid, processed food or trans fats food, because that's going to be bad for your health and for your brain.
Should they be going to bed a little bit hungry every night?
Yeah, you should be going to bed a little bit hungry. It's better because if you have overeaten, then you're probably going to have reflux, and then you're going to have a bad night's sleep. So yeah.
Okay, and then let's
Enough
close
fruit,
with
enough vegetables, enough water. Avoid sodas. Avoid processed foods. Avoid meat.
Oh, okay. Now, last question on that. Is it true that garlic will naturally lower cholesterol, lower blood pressure, or is that not
No,
true?
I don't believe that.
You don't believe it?
No.
Doctor, I want to say thank you so much. I appreciate the interview.